Hi there, thanks for staying tuned. So in this video I'm going to talk to you mainly about the risks that are associated with having a dermal filler treatment. So the main four, which are usually the ones that most people come up against, is purely down to the fact that we are using a needle to pierce the skin. So those main four are bruising, bleeding, swelling and redness. Because we are using a needle to inject the dermal filler into the skin, we actually have to pierce the skin, whether we're using a needle or a cannula to do so. So obviously the piercing of the skin will cause a microscopic hole, which can bleed, of course. So our face is full of arterial blood supply and venous blood supply. Of course, we need that there to make sure that we're getting oxygen to our skin. So if we pierce the skin, we've got lots of little vessels underneath, so there is a chance of bruising. So bruising is a 1 in 10 chance of bruising, particularly some areas more so than others. Around the corners of the mouth is absolutely certainly you're more than likely going to get a bruise, and those treatments are done either at the latter end of having a nasolabial fold work, or if you're trying to turn that frown upside down and bring it up and work on the marionette lines too. That tends to be quite a bruisey type of area. Also lips can bruise like a peach, but it doesn't mean that you're going to end up with a dissatisfied result at the end of it. Obviously we do try to reduce the amount of bruising that we do by going through your medical questionnaire, see if there are any medications that you are on that would make your bruising risk more, and also certain supplements as well, such as ginseng, vitamin E. Those can make you more susceptible to a bruise too. So bruising, bleeding. So if we were to, that bruise is obviously caused by bleeding. If that bleeding was to bleed quite a lot under the skin, you can have something called a hematoma, which is like a blood clot under the surface of the skin. Now, blood clots do take longer to disappear than a normal type of bruise because it's coagulated underneath the surface and can quite, if it's been there for a while, which it can take weeks to dissolve by your body's normal mechanisms, it's quite fibrous underneath, so you can feel sometimes like a hard, gristly sort of ball under the skin. If you did have a lot of bruising, that's probably what you're feeling is the fibrous remnants left of the platelets and the fibroblasts that have all intermingled into making a clot. So that can take a couple of weeks to dissolve. Swelling, of course, even if you bit your lip with your teeth, you know that lip swells up quite a lot. Lips swell a lot, and somewhere between 40 and 60% with some people. People do swell. Swelling should settle down within 24 to 48 hours. However, if that swelling is still there and it's quite ouchy, then you need to come and speak to me again. But normally an antihistamine should help with swelling quite nicely, and a cool pack as well. So swelling that's still there after a couple of days can be a sign of infection or allergic reaction. So it's important to come back and see me. So those are the main ones really. Injections down to the bone don't tend to bruise as much, but it's more in the softer tissues where you do tend to swell up. Some people just walk out and the swelling's already gone. So everyone's very differently. You know your body the best, so just sort of make a sound judgment. And if it's something you're doing personally for yourself and you don't want anybody to know about it, then maybe you might want to think about having maybe a couple of days off just in case. So bruising, bleeding, swelling, redness. So obviously we've pricked the skin and I'm pinching and everything, so it can get a little bit red. That redness should settle down after a couple of hours. It can take a day or so as well for some people. Again, everyone's different, but redness that seems to be there longer and is quite warm to the touch or quite ouchy can also be a sign of allergic reaction or for infection. So again, if you're having any of these symptoms that seem to be not been getting better as the time goes on, get back in touch with me. You might need to have some steroid or some antibiotic cover. So those are the main sort of basic ones. I'll tell you more about some more of the severe ones in this next video.